Well, a warm welcome to today's talk, Monday the 23rd of May in the evening. Now, we've just done a short 5-minute video on the transmission and clinical features of monkeypox, and I want to do a bit of a more detailed consideration of what's going on at the moment, because we have got a fairly clear picture emerging. Two main reasons I want to do this. We've just had a case being diagnosed in Denmark, a couple in Canada, the United States, Australia, Europe. This seems to be popping up in various countries all at the same time. Okay, there's not many cases, probably only a couple hundred cases, but popping up in various parts of the world. And this means it's been spreading in the past few weeks. So this has been spreading earlier than we had thought. The second and the most important reason I want to cover this is unlike COVID, monkeypox will make young children very sick indeed. And this is really quite concerning. This is my main concern. I don't think there's going to be another pandemic of this because it's transmissible when it's symptomatic. So we can learn how to isolate people. We're not going to get the asymptomatic, pre-symptomatic spread that caused the COVID pandemic. But household transmission is really quite likely to occur. If there's an infected person within a household, they could infect children a bit within that household, and the children can become very ill. This is why we need to have a high index of suspicion for this disease, and we need to isolate at an early stage, particularly protecting children, particularly protecting pregnant women, because of the effect this can have on unborn children and possibly even causing premature and still births. So a completely different sort of target, if you like, for this disease. Pregnant women, unborn babies and young children. Really quite concerning. So that's why we want to cover this. This is covered in quite a lot of popular press outlets, and as well as WHO official information. Now, we did just look at the transmission in the previous video, so I'm not going to do that in detail now. We'll just note that this is the transmission here. It's originally zoonotic, it's now person to person. Now, this is spread in respiratory droplets, but it's the large droplets. So when you breathe out, you'll breathe out some medium-sized droplets of water, some huge droplets of water, some little droplets of water, and some tiny aerosolized droplets of water. So the monkeypox is transmitted in the bigger ones. And the bigger ones, of course, are heavy, so they drop out more quickly. So they're not going to float around in the air like these small ones do, the aerosolized ones that can float around for hours. So this means close contact respiratory droplets. It's a close contact disease. Body fluids and mucous membranes we mentioned. Now, so far, the disease has been transmitted largely, but not exclusively, due to male homosexual behaviour. Now, this is not a product of male homosexual behaviour as such. It's just a product of the intimacy and the fact that this is where this seemed to have started. It was spread equally well with heterosexual activity, and indeed any close contact followed up, and this is the more concerning thing, followed up by household transmission to children who are in a close proximity to infected people. And of course it can be transmitted via surfaces as well, as we noted. Now, moving on to what people are saying about this, let's start with the European Centre for Disease Control first of all. European CDC, the direct quotes: mortality is higher amongst children and young adults. This is very bad news, and it's the exact opposite of COVID. The reason being is that older people will have come into contact with a wider variety of viruses. Now, if you're very old, like me, you'll have probably been vaccinated. Well, I was vaccinated against smallpox, of course. And vaccine against smallpox is not going to perhaps stop me getting symptomatic monkeypox now, but it should stop me getting very sick and stop me dying. It gives long-term protection against severe disease, we believe, even over many decades. And as well as that, older people have come into contact with many different viruses, some of which are similar to monkeypox, so they get this cross-immunity effect, whereas children and young adults, because they've come across less viruses, they're not going to have any immunity at all, and they can get severe disease, particularly children can get severe disease, and of course it can be life-threatening in that age group, this is the frightening part about it. Immunocompromised, obviously, are going to be more at risk, but it's the children and young adults, of which we've got plenty, that are the problem. Most people recover within weeks, but most doesn't mean all, of course. Most cases presented with lesions in the genital and peri-genital area, indicating that transmission likely occurred during close physical contact during sexual activity. Now, these are the cases in Europe so far, because so far in Europe, a lot of the transmission, as we've said, has been in gay men, male homosexual spread. But this is just a founder effect, as we'll see. I'll be giving evidence for that in a minute. Now, in terms of the states, President Biden, direct quotes, they haven't told me the level of exposure yet, but it's something that everyone should be concerned about. We agree with that because of the risk to children. We're working on it hard to find out what to do and what vaccine may be available. Now, I can help President Biden there. The vaccine is available, and it's mostly actually the smallpox vaccine. Now, and not a lot of people know this, but governments actually have large suppliers of smallpox vaccine. Because with smallpox was eradicated in 1980, of course, but the risk is that smallpox could be used for biological warfare. Because the population now, under the age of about 55, in the UK at least, is not protected. Therefore, if this was introduced as a biological warfare agent, it could cause a massive pandemic of really severe disease. So that's why the vaccine is kept. It's a strategic reserve of vaccine that we keep. And because the monkeypox is in the same group of viruses as the smallpox and the cowpox, because it's in the same group of viruses, we get a lot of cross immunity. And one of the smallpox viruses is actually authorized specifically for use in monkeypox, but actually primarily they are smallpox viruses which we keep for purposes of national defense, just in case they're needed. President Biden again, but it's a concern in the sense that if we were to spread, it would be consequential. It would indeed. And it does appear to be spreading. It's not going to be a huge pandemic, but it could spread and kill some children, which is really quite frightening. Everyone should be concerned about the rise in cases. We agree we have to be aware of this and stop it. 148 cases, probably about 200 and over 200 now confirmed outside Africa in the current outbreak. Not a lot, but as we said, because they're occurring in many places at the same time, this means there's been a lot of transmission already. In the States particularly, Massachusetts a definite case, Florida and New York very likely to be cases. I expect they'll be confirmed in the next, in fact they might even have been confirmed by the time we watch this video. They're just waiting for definitive diagnosis. Centre for Disease Control in the States. There's currently no proven safe treatment for monkeypox virus infection. There are some antivirals, but this is what the CDC is saying. They don't have a good antiviral. For purposes of controlling a monkeypox outbreak in the United States, smallpox vaccine, antivirals and vaccine immune globulin can be used. So smallpox vaccine, which are stockpiled, at least in the States and the United Kingdom, as we said, for essentially purposes of national defence. Spain. Cabinet Minister for Health in this region, a couple of days ago, 30 cases in Spain, mostly linked to a spreader event from an adult sauna in Madrid. Now, I'll leave your imagination to run riot for an adult sauna in Madrid. The Public Health Department will carry out even more detailed analysis to control contagion, cut the chains of transmission, and try and mitigate the transmission as much as possible, obviously. You would expect him to say that. So it looks like this super spreader event in a sexual context in Madrid, and we believe are related to gay men at the moment, male homosexual transmission. But as I say, it's not that it's particularly a sexually transmitted disease. It's just where that has started. It will carry on being sexually transmitted, but it will also be transmitted in normal ways, as we say, through families. Older brother to younger brother, mother and father to children is the one I'm concerned about. Apparently there was an international advertised gay party in Spain being investigated as the root cause of the global monkeypox case. So it looks like someone's come from possibly Nigeria to Spain. There's been spreading of the virus in this event in Spain, and then people have gone off to various places. So presumably this major, whatever it is, major party in Spain has attracted people with this particular interest from various parts of Europe, and have now gone back, and that's why the disease has popped up in these various countries. So intimate spread, but now resulting in less intimate family household-based spread. Now, the United Kingdom, again, we were told a notable proportion of the recent cases in Europe have been found in gay and bisexual men, so we are particularly encouraging them to be alert to the symptoms and seek help. Not that many cases in the UK, 20 as of a couple of days ago, were contact tracing, were quarantining close contacts, of course. And really what we need to do at the moment is raise awareness of this so that no children are exposed. That's really the important thing. Belgium, 3 cases linked to the Darklands Festival in Antwerp. There's no reason to assume that the virus has been brought in by visitors from abroad to the festival after recent cases in other countries. So it looks like this is now buzzing around Europe, again, particularly in male homosexual organised activities in Europe. Darklands is apparently a ticket event, and apparently the attraction there is various tribes in the gay fetish community come together to create a unique spectacle of fetish brotherhood. I'll leave you to interpret that in any way you like, but I think it's fair to say that there's been intimate activity there which has spread the disease. Now, the other thing is the gay pride sort of season is coming up now. So go to any website and you'll see this sort of thing. So this one here is called Rainbow Walk on just next week, really. This one, Portugal, London Gay Pride, Baker Street Station, 1st of July. Anyway, this sort of activity is going on. Now, I'm not worried about outdoor activity with people that are feeling healthy, because we're not going to get the asymptomatic spread and the pre-symptomatic spread. So walking down the street, waving a placard or whatever you would like to do, is not going to spread the disease as long as everyone there is feeling well and don't go if they're symptomatic. And I think we can trust that we'll get enough publicity out that people won't go when they're symptomatic. The problem is any breakout activity associated with those mass events. So it's not the event themselves, it's what can go with the event that would be the problem. So the gay pride events are starting nowish, which would be a concern of potential spread due to parallel activity as a result of those events. World Health Organization, Hans Klug, that we've mentioned many times as COVID. As we enter the summer season within the European region, with mass gatherings, festivals and parties, so he agrees completely with that. I'm concerned that transmission could accelerate as the cases currently being detected are amongst those engaging in sexual activity. But as we say, there's a child already involved in the UK. It's already breaking out from this nidus where this began. It began seems to have began in male homosexuality here. But now it's spreading out into the wider community, and I'm particularly concerned, as we say, about pregnant women, and I'm particularly concerned about children, particularly through household spread. The symptoms to many are unfamiliar. Monkeypox is normally a virus that is hard to spread from one person to another, and this is the first time there's been a sustained human-to-human transmission outside Africa. Interesting. Now, is this because the virus has changed, or is this because we've had the sheer bad luck that the virus has entered into the male homosexual community? Much as we saw, really, with HIV. I mean, HIV, of course, can be spread heterosexually or homosexually, but it began in the homosexual community, primarily. American people visiting, American men particularly, visiting Haiti, which was a focus of early HIV, but the history of that is well documented in other places. This is a Bavarian Nordic. This is Bernard Holt, who's one of the bosses there, biotech company. An undisclosed European company has put in a large order for vaccine doses. So I suspect it's not the UK, because we've already got large stocks. I'd be surprised if most European countries didn't have large stocks, because it's standard protection against, as we said, biological warfare. Anyway, he goes on, this biotech company. The reason why this vaccine was developed was to have a safe vaccine for stockpiling in case of an outbreak of smallpox. Okay, there could be outbreaks of smallpox if the virus escaped from laboratories where it is stored. I know for certain that smallpox virus is stored in Porton Down in the UK. That's not a secret. It's stored in the United States. It's certainly stored in lots of places in Russia and other other countries around the world. I'm sure China's got a supply, and other countries as well. We're in contact with the UK authorities about the use of the vaccine. Well, I don't think we need mass vaccination at the moment, but I am concerned about this spreading to children. Sajid Javid, Secretary of Health in the UK, procured further doses of vaccine that are effective against monkeypox. So Sajid, so we bought some more in the UK as well. So quite what they are thinking there, I am not sure. If we can, let's get this contained and stop it spreading to children. Really quite alarmed to learn there was a child already in the UK in intensive care as a result of this virus. That is really quite a big concern. It's not going to spread that widely, but the people that I don't believe, because it's not spread, as we said, not spread asymptomatically or pre-symptomatically, but the households it does spread in could be devastating. And it won't take many thousands of cases or tens of thousands of cases of monkeypox to kill way more children than COVID ever did, which is my concern for that age group. It's bad for anyone to die, but for children to die is, not good. Not good. As we said, again, we did this in the previous video, incubation period, 6 to 13 days. So someone's exposed to the virus, feels fine for 6 to 13 days. Then prodromal means they start feeling generally unwell. And at that stage, you can get swelling of the lymph nodes in the neck, armpits, groin. Prodromal phase is the phase of an illness where someone thinks, well, I basically don't feel well, but it's not localized to any part of the body yet. So that's when that can happen. Lymphadenopathy should be a warning feature. So feel free to feel lymph glands. It's not that hard. I mean, lymph glands, you've got them in your neck, under your jaw, in the armpit, in the groin. You've got them other places, but they're the places where you can feel them. Feel free to palpate yourself if you are concerned, and of course, slightest concern, get checked by your healthcare provider, of course. Acute illness, so there is a fever. The chills or rigors means that the body temperature is warming up, which I believe is good because it helps to combat the virus. Headache is a feature. Muscle pain and backaches are a pain. Myalgia and intense asthenia. Asthenia means sort of weakness and tiredness. It's a term we don't often use that often in the UK, but weakness and tiredness. And then the rash comes after that, and we won't show the pictures of the rash again. We showed those on the last one. Now, the rash often begins on the face, but the rash in a lot of the current cases after male homosexual activity have been in the genital area and around about the genital area, indicating how the virus got into the body, presumably, because that's where the spot started. But typically the rash starts, the pustular spot starts on the face, typically. And this is what we'd expect to see if the infection is spreading in households of the initial infected cohorts. Spreads elsewhere in the body, soles of the feet, palms of the hand. So the symptoms, the rash develops a few days after first symptoms, then it goes through this change and eventually becomes pussy, then dries out and then falls off. But it can be very itchy, can be painful, and they can leave some scarring as well. So our role at the moment is to educate groups who are at particular risk at the moment. But remember, this is not, well, although it can be a sexually transmitted disease, it will be spread by close contact in families and in households, which is the concern. So be aware of it. If you suspect it at all, isolate, especially from children, especially from pregnant women, and obviously get medical advice as soon as possible. Because we're dealing with a contagious disease, of course, ring ahead to your healthcare provider, tell them what your suspicions are and do exactly what they tell you. And we should be able to nip this in the bud, really, because people aren't transmissible. The disease is not transmissible till people are symptomatic. So as long as people are sensible, and of course the vast majority of people are, virtually everyone is. You only get the odd person that's not, whether they're in a homosexual, heterosexual, whatever community they're in. Everyone's sensible. We don't want disease. Just recognise it early, and for goodness sake, tell people. And I'll put the link to the 5-minute video that I did. If you could spread that, I mean, I know this video is for us that are particularly interested, this long one. But if you could spread the 5-minute one around, that would be good, because that just tells people how it's transmitted, what to look out for, and to get help as soon as possible before this disease is transmitted to vulnerable people due to immunosuppression, or children, or pregnant women. This is why this is so important. So over to you on that, and thank you very much for watching.